Hello guys, thanks for watching. Hope you're enjoying them. Hope you learned something. So today we're going to talk a little about just some basic neurology stuff and kind of what I want some of my clients to look out for some early signs for neurologic issues. I'm not focusing on seizures. We're going to focus more on conscious proprioception in this talk. So conscious proprioception, what is that? What does that mean? Good question. Conscious proprioception is where your limb is in space. So basically, if I close my eyes, I know my arm is in front of me, I know my arm is above me, to the right, or behind me. That is called conscious proprioception. For short, CPs. I'll probably refer to it as CPs here moving forward, just because it's easier to say and a little bit faster. So CP deficits. A lot of times we will see these with spinal cord issues, IVDD, intervertebral disc disease. That can happen at any species, at any age, and anywhere along the spinal cord, which means anywhere from the neck, the atlas axis, base of the skull, all the way down. If it happens past a certain point, there are less nerves past some of the lumbar spine. So basically, if there's not really a nerve going down there and you have a compression or a slit disc or inflammation, irritation, a cancer, whatever it will be, there's no nerve there to compress, therefore you don't have the issue. So nerves start in the brain, your neurologic stuff, that's the big one, and then as it goes down the spinal cord, you have different branches break off and go to your limbs, your heart, your area, diaphragm, your GI tract, your hind legs. People are familiar with the brachial plexus or the radial nerve and the ulnar nerve. You have a radial bone and an ulnar bone. So they go in those areas. The femoral nerve, femoral artery, they go past the femoral bone, femur. So, you know, some of those names fit, they make sense. We're going to keep it kind of basic because most people don't have a large medical background in that terminology. So, ultimately, CPs, conscious proprioceptive deficits. When we're assessing those, we're usually dealing with the spinal cord, aka some of those nerves are being compressed. Depending on what leg we are seeing these deficits in, tells us where in the spinal cord that we're looking for it. The spinal cord is the cervical, the vertebrae, which houses the spinal cord. There's different sections of it. There's the cervical section, thoracic section, lumbar section, and the sacral section. Essentially, the neck, let's call it the ribs and the chest area, your lower back area with lumbar, and then the sacral would kind of be more the hip, pelvis, rump, tail area, and then keeps going a little bit. What you're looking for is, on dogs and cats, what you're looking for is when they're walking, do they place their paw properly? They should know without looking that their foot is down on the ground normally. And I don't want to see any dragging. We can look for scuff marks on the fingernails. That's an indication that they're not picking their foot all the way up, either because it's broken and they can't and it hurts, or underlying arthritis, it hurts, or neurological, they think they are, but they're not, and they're just dragging it instead of picking it up and placing it down. An easy way for owners to check this at home is have your pet stand. If you have another pet, use your control. Use multiple pets, then you can kind of compare if you're unsure. But what we'll do is we'll have them stand and patient standing, and we will take their foot and we will flip it backwards and kind of put the top part of the paw down. Instinctively, they should just pick it up and replace it properly. Occasionally, we'll have a very well-trained patient and they will do it because they're that well-trained. There's other techniques that we can go into later called wheelbarrowing and little table tests and different ways to kind of check for that. Skipping, hopping tests. Talk for another day. So mainly we'll look at those paws, and patients should normally, without being able to see it, should know that their foot, my hand, is down and that's uncomfortable. It should be up, even if my eyes are closed and I can't see it. So if you're noticing your patient swinging his foot out more than normal, or dragging it, or when he stands, he kind of has one knuckling over, those are some signs of CP deficits, and touch base with your veterinarian. Some of those cases we can treat medically and do very, very well with. Some of them, there's masses, there's slipped discs, those are surgical issues, and your veterinarian can walk you through some of those advanced imaging. So, something a little different, and hope you guys enjoyed that. Keep an eye out on your little fur babies, and be safe, guys. Bye.